Now, there's another aspect of diet which is really, really so important. And that pertains to what happens in the gut when we have too many sugars and too many carbohydrates. Because we overwhelm the ability of our upper gut to remain sterile. Now, of course, I've jumped ahead of myself. I'm very good at doing this, or rather very bad at doing that. But basically, the gut is a tube. It starts in the mouth, it finishes at the anus, and it's about 30 foot long. Now, the top 25 foot of gut should be near sterile. It should be near sterile for the business of digesting proteins, breaking down fats and absorbing them, mopping up some of the starches that are naturally present even in meats and vegetables. And as I say, it should be near sterile. Now, if we eat a lot of sugar and carbohydrates and we're snacking all the time, breakfast, snack mid-morning, lunch, snack mid-afternoon, supper, late night munches, then you overwhelm the ability of the upper gut to remain sterile. Because when we eat food, there are inevitably bacteria and yeast in food. That's unavoidable. Okay, cooking it will reduce that to a certain extent, but all food will contain bacteria and yeast. If you eat a plum, like I did for lunchtime, it's a bag of sugar with yeast on the outside. So I've got good stomach acid, and I know that will be sterilized, and I don't have enough fermenting gut. But if you've overwhelmed that ability, then those foods will start to ferment. And when those foods start to ferment in your gut, that is a disaster. It's a disaster for lots of reasons. The first thing is you ferment those foods into toxins that have to be dealt with by the liver. This condition is also called the auto-brewery syndrome. In fact, it was first described in the Journal of Nutritional Medicine in about 1996 by Stephen Davis and John McLaren Howard. And they took people who had enough fermenting gut. They measured the levels of sugar and alcohol in the bloodstream. They gave them a 50-gram load of sugar, which is standard for a diabetic test, for example. And then they repeated the sugar and alcohol levels half an hour later. The highest result they got was an alcohol level of 19 milligrams per deciliter, which is not far off a drunk driving ticket in this country. So you can produce significant amounts of alcohol, not just ethyl alcohol, but butyl alcohol, propyl alcohol, D-lactate, amino alkyl compounds, hydrogen sulfide, i.e. lots of nasty toxins. So that's one reason why the upper fermenting gut is real bad news. The second problem is that if you start to take some vitamins and minerals, and of course there are lots of essential nutrients in food, if you've got an upper fermenting gut, then you just feed those bacteria and yeast because they're in the front line. Oh, yum, yum, they say, I need some B3, I need some CoQ10, I need some of this, that and the other, because their metabolism is not that different from ours. So our body then becomes deficient in those micronutrients. And then the microbes themselves, again, just like plants, if you look at life from the point of view of bacteria or a yeast, having made itself comfortable on the lining of your gut, it doesn't want anybody else moving in. And so those bacteria and those yeast, they produce nasty toxins to keep other bacteria and yeast at bay. And those bacterial things we call bacterial endotoxin. It's very nasty stuff. Fungi produce fungal mycotoxins. In fact, many of our antibiotics are mycotoxins, and they've got fungal names like penicillin, streptomycin, cephalosporin, gentamicin. These are all fungal products. So the microbes themselves produce toxins, which have to be dealt with by the liver, and that consumes a lot of energy. But these microbes actually live on the lining of the gut. And where they are living, there's low-grade inflammation. And low-grade inflammation makes for a leaky gut. And so there is potential for the microbes themselves to get from the lining of the gut into the bloodstream. Now, these are not evolutionary correct microbes. These are not microbes that the immune system is familiar with. And wherever they get, they'll get into the bloodstream and circulate. And wherever they get stuck or lodged, the immune system is, oh, we've got an infection here, we've got an invasion, we better attack it. It drives inflammation. And I think many, many conditions like fibromyalgia is allergy to microbes from the upper fermenting gut in the muscles. Arthritis. All arthritis is allergy, and much of it is driven by allergy to microbes from the upper fermenting gut. They get stuck in the brain. And in the brain, and this is work done by a Japanese researcher, they have the potential to ferment out neurotransmitters in the brain into LSD and amphetamine-like substances. And that could be the basis of psychosis. They get stuck in the skin and drive urticaria. They get stuck in the lungs and drive intrinsic asthma. They get stuck in the gut and drive inflammatory bowel disease. So there is so much pathology that's driven by these little wretches that this is such an important reason why, we should sort out the upper fermenting gut.
Just to be clear here, this is like SIBO, but it's SIBO 2.0. So it encompasses what SIBO is, but it goes beyond. So Avi, explain that.
Correct. SIBO is just upper fermenting gut by bacteria, but Candida is upper fermenting gut by yeast. But maybe parasites could be involved, maybe yeast involved. We don't know because there's just not enough work done on this. But the bottom line is the treatment of SIBO, upper fermenting gut, is exactly the same. First of all, stop feeding them, carnivore diet or very, very low ketogenic diet. And secondly, kill them. And the two of my favourite tools that I use to kill that are vitamin C and iodine. Now, we are all deficient in vitamin C without exception. Not my words, but the words of Linus Pauling, jolly clever man, won two Nobel Prizes, on his own, and was only beaten to a third by Watson and Crick. But he devoted the last third of his life to the study of vitamin C. Now, what he points out is that it's humans, fruit bats and guinea pigs that can't make their own vitamin C. So the reason my best friend, my little dog Nancy, doesn't get scurvy eating a meat diet is because she can make her own vitamin C. We can get some from meat, interestingly, but we can use vitamins in different ways. We can use vitamin C in tiny doses to stop us getting scurvy. We can use vitamin C in higher doses for optimal biochemical function. And then we can use vitamin C in super high doses, basically as an antimicrobial, as an antibiotic and anti-fungal agent. I recommend we all take 5 grams of vitamin C a day. That's about a rounded teaspoon. And a glass of water, first thing in the morning, dissolves much better in warm water, down the hatch. And vitamin C contact kills all microbes. First thing in the morning, the gut is empty, or the upper gut is empty, so you get a good concentration of vitamin C immediately hitting the stomach. And of course, the stomach is a very acid place. That's Nancy, is a very acid place. And acid kills all microbes. And so you start off the day with a nice, sterile upper gut. And then last thing at night, maybe 2 or 3 hours after you've had your evening meal, before going to bed, 3 drops of Lugol's iodine, 15% in a glass of water, down the hatch. And again, iodine contact kills all microbes. It's the best antiseptic in the world. This is why any patient having surgery will wake up, or should wake up, with the yellow all over there, over there where they've been stitched up, because iodine penetrates the skin and contact kills all microbes at 10 parts per million. It's an incredibly powerful antimicrobial. And the interesting thing about iodine is it's completely, almost entirely, it's completely harmless to humans. It doesn't interfere with the immune system's ability to heal and repair. And we're all deficient in iodine, pretty much without exception. We just don't get enough of it in our diet. So it's, there, as and both iodine and vitamin C are incredibly cheap.
Okay, coming back to vitamin C before we move forward.
Yeah.
You mentioned the fact that us and a couple other animals are the only ones that aren't producing it naturally in the body. How do you look at that from an evolutionary perspective? Since we did lose that, that would lead us to believe that that's a good thing if evolution had that leave our genetics. So talk about how you think about that.
That's a fabulous question. And it's a question, something I've given a lot of thought to. And I think the important thing is we evolved primarily as carnivores. We didn't evolve to eat meat. We evolved because we ate meat. So I'm a great fan of Elaine Morgan's theory that humans spent some time in evolving from water. So the story is that we started off as chimpanzees, which are our nearest relatives in Central Africa, and then there was a window of time of global warming. So the animals are forced out to the coast, And some of the chimpanzees realized that they could evade their predators by moving into the water. And moving into those shallow, warm seas, first of all, the seas were buoyant, so they could stand up on their back legs. Secondly, we lost our fur, lost our hair, we became hairy, and we evolved subcutaneous fat instead to keep warm. Our noses turned down, so that means we could duck underwater without drowning. If you put a chimpanzee in water, because their nostrils turn up, the water pours into the lungs and they drown very quickly. But because our noses turn down, we can survive dipping our head underwater. And we fed on seafood and shellfish. And seafood and shellfish are extremely rich in the two vital fats for our brains, arachidonic acid and DHA. And that allowed our brains, and of course it's rich in iodine. Without iodine, the brains can't grow. And that allows our brains to get much larger. So a chimpanzee's brain size was about 350 mil and is still about 350 mil. At one stage, our brains were as large as 1700 mils, hugely, five times larger than a chimpanzee's brain. So becoming intelligent like that made us very effective hunters. And as I say, the big prey the large herbivores were our prey, which are also rich in arachidonic acid and DHA. And eating a carnivore diet, if you eat the offal, especially the liver and the kidneys, that is rich in vitamin C. And the second thing is, if you're eating a carnivore diet, you do not have an upper fermenting gut. And my guess is an awful lot of vitamin C was used up in the business of controlling that upper fermenting gut. We're relatively protected from infection. Why? Because we're eating carnivore. As I say, it's the sugars and the carbohydrates that feed infection. I'll just tell you a story about that. And this is a story that happened to a patient of mine. She came to see me in the August, only a young lass, 23, and she had severe abscesses in her arm, a number of them. We call them the carbuncle. And she'd had these for about 2 years. She'd had every antibiotic under the sun. She'd had surgery. She'd had drains in there. The surgeons didn't dare do any more surgery because it was invading her brachial plexus and she risked losing the nerve supply to the arm and indeed the arm itself. But nobody had taken a dietary history. She thought it was healthy to have lots of fruit. And so she was having, pints of orange juice, pineapple juice, fruit, oranges, mangoes, whatever, grapes, and running a high blood sugar. And that was feeding that infection. And all we did, I said, right, you've got to do a ketogenic diet. So she cut out all that fruit, cut out all the sugar and the carbs, low carb diet. And then she just painted it with iodine daily. That was in the August, when the surgeons had given up with her, and without any further antibiotics, without no further surgery, by Christmas it had healed up completely. Now, that illustrates the point that sugar and carbohydrates feed infection. If you're doing a carnivore diet, it's intrinsically ketogenic, and just being ketogenic is highly protective against infection. So I think that the requirement for vitamin C was less, but of course you can get vitamin C by eating meat, especially offal. People think a carnivore diet is just loads of steak. Yes, but it's also liver, kidney, if you can get it, bone marrow, if you can eat it, brains. It's also all the other cuts of meat that are so important. So the point is that they survived. And the other key factor here is evolution is only interested in us getting to child rearing age. You see, I'm on the evolutionary scrap heap. No more babies from me, I'm afraid. All the eggs have gone, and my daughters are launched. It doesn't matter if I die. It doesn't matter if I don't live to a great age, because, as I say, I've passed on my genes, and that's that. And that's where the real problems of vitamin C deficiency really cut in old age, because we know that vitamin C deficiency is again associated with cancer, majorly heart disease and dementia. So it's a combination of those things which allowed us to get away with the fact that we can't make our own vitamin C. Now, my guess is there are probably other facets to that story which I will discover in the future, but I'm happy with those explanations for the time being.
Let's come back to our upper fermenting gut. We left that story in the middle. We've talked about vitamin C in the morning, iodine at night. Last time you were on, we talked about MSM being part of that protocol. Are you still a fan of that?
Oh, hugely. Again, what I'm looking for is, you see, there aren't enough doctors like you and me to go round. There just aren't enough of us. And so what we have to do is to develop tools that everybody can use, that are not on prescription and can be easily incorporated into your everyday life. And those tools must be safe, cheap, effective, and multitask. And one of my favourite multitasking tools is MSM. Now, I learned much of this again from Stephanie Seneff, brilliant US researcher, who points out that we are all deficient in sulfur, almost without exception. And sulfur is a very, very important molecule. It's a very important molecule because it improves something called fourth phase or exclusion zone water, which we can talk about. But the thing is, we're all deficient. And without that sulfur, there are so many things that we can't do. But as far as the gut is concerned, MSM has the very attractive property of killing microbes in an aerobic environment, and the upper gut is largely aerobic. But in an anaerobic environment, i.e. where the microbiome is, it acts as a prebiotic, it feeds them, it's a fuel source for bacteria. So that makes the double whammy for the gut. And also by improving, and of course, this is why another reason why the carnivore diet is so healthy, because it's naturally rich in sulfur. Meat, is rich in sulfur. So, and this I think also explains why constipation is not a problem in people doing a carnivore diet, because again, we were taught at medical school, and I carried this myth with me for many decades before I saw the light. We taught that constipation is all about not enough fibre in the diet. But as the carnivores point out, adding more fibre to the diet is like adding more cars to a traffic jam. It's not going to get at the root cause of the problem. And my guess is that constipation is all about friction. It's the friction between the lining of the gut and the gut contents. And if you've got a frictionless, or near frictionless interface there, then the gut contents are going to slide through effortlessly, and constipation is just not going to be a problem, or not going to be an issue. Now, with the carnivore diet, you might not produce a daily turd, but when you do produce it, if it's passed effortlessly, problem solved. You're not going to get piles, you're not going to get anal fissures, you're not going to get all the problems associated with constipation. And the mechanism by which MSM improves fourth phase, and the mechanism is because MSM improves fourth phase water. We know that as a fact. Do you want me to talk briefly about fourth phase water?
Yeah, give us an overview of what that is, and then you can talk about MSM and tie that in.
Another one of my favourite subjects. Now, this is all thanks to the wonderful work of a fantastic physicist called Gerald Pollack, who was back looking at water again. Now, we know water can exist in three phases. It can exist as a solid, that's called ice, as a liquid, that's called water, and as a gas, and that's called steam. But he points out that it can also exist as a fourth phase. And that's what water molecules do against a surface. And that surface can be a fat-loving surface or a water-loving surface. Now, the chemical formula of water is H2O, 2 hydrogens and an oxygen. An oxygen is comprised of 6 protons, and protons have a positive charge. Hydrogen ions only have 1 proton. And that means that that the electron cloud is slightly pulled towards the oxygen atom, because the oxygen atom's got a 6 proton pull and hydrogen's only got a 1 proton pull. So what it means is every water molecule, the oxygen atom is slightly negatively charged and the hydrogen atoms are slightly positively charged. And against the surface, they will align in a honeycomb-like structure. And a positive hydrogen to a negative oxygen, to a positive hydrogen to a negative oxygen, to a positive hydrogen, and so on. And that honeycomb structure piles up one layer on top of another in layers of very organised, structured, gel-shaped water. So just to illustrate that point, if you totted up all the molecules in your body, you and I are 99% water. 99% of the molecules in our body are water molecules. So if they were in a liquid phase, we'd just drop on the floor like a puddle, wouldn't we? But it's this structured water that gives us our form, our shape, that's the rigidity. But if you tot up all the electrons and protons in there, you find it doesn't add up. You've got too many protons. It doesn't quite fit. And so this is why this water is also called exclusion zone water. So we've got 3 names now. Exclusion zone water, because it excludes the protons. The protons get squeezed out, they get shoveled out. And what this means in practice is that every surface in our body, every cell surface, every mitochondrial surface, every red cell, every white cell, every platelet, every protein has got this jacket, this coating of structured charged water. It's all negatively charged. Now, if you've got 2 magnets, and you put them together, and they don't touch, do they? They push each other apart, and so they can move across each other effortlessly. In fact, there's a train system in Japan, in China, that's been developed that runs on this system. The rails are electromagnetically charged, so the train hovers over the surface, and it can get 400 kilometers an hour. It flies along because there's no friction there. It's the same in the body. Every surface is negatively charged, so there's no friction there. And so it should be in the lining of the gut as well. And what we know from Stephanie Steinhaus's work and Gerald Pollack's work is that having some sulfur molecules around massively increases the thickness of that EZ water. And increasing the thickness of it, you increase the charge of it. So it's even more negatively charged. And therefore things move around even more in a more frictionless way. And in the gut, this is very helpful because gets rid of, that means the gut contents can flow through very easily. It's essential in the bloodstream because it accounts for capillary circulation and allows blood to flow in a near frictionless way. In fact, one fascinating example of this is that if you take some poor animal, and let's not think of the animal, and you stop and you anaesthetize it and you stop the heart beating, so long as you keep that animal warm, the blood will continue to circulate for several hours. And it's driven by the electrical force of exclusion zone water, which takes place in the capillaries, and the fact that blood is near frictionless when it's kept at the right temperature and is flowing. So it's all about EZ water. And I think this also has the other major use that I use for MSM is for detoxing heavy metals. Now, we know we can get rid of pesticides and volatile organic compounds by heating regimes, but you can't get heavy metals out. They don't come out in the sweat, or they don't come out, they don't mobilize from subcutaneous fat when you get hot. And the reason for that is these heavy metals actually get incorporated into body tissues. They get stuck in the heart, they get stuck in the kidneys, in the bone, in the brain. And the reason I think they get stuck there is because if we get deficient in a mineral like zinc or magnesium or selenium, and guess what? Deficiencies of those 3 minerals are very common. The body will grab something that looks similar. And if it grabs mercury or aluminium or cadmium or arsenic, which we all carry in our bodies, then they actually get incorporated in that tissue and they get stuck there. Now, what's so fascinating is I had a patient who came to see me, and again, this is another story. Lovely guy, Frank Dalton. Yes, I can use his name. He's given me permission. Who was very interested in his heavy metal loads. And he was doing tests of heavy metal poisoning every 6 months. And when we test for heavy metals, there's no point just doing urine tests because you won't see anything. You have to use a chelating agent. And there are several that can be used, but the one I like to use is DMSA. Dimethylsuccinic acid, because you can take it by mouth. So this makes it, doable for my patients. And the way that it works is you wake up one morning, you take a dose of DMSA, 16 milligrams per kilogram body weight, collect the urine for the next 6 hours, and then measure the heavy metals that are there. And that gives you a pretty good idea if you're toxic. And he started doing these tests about 4 years ago now. And the first test and the second test showed that a bit spike of mercury, which often comes out, a spike of lead. And then after that, it was fairly normal. And he continued to do these for a while. I said, Frank, you don't need to go on doing these tests because it looks like we got out all the heavy metals. No. He carried on. Now, it just so happened I started him on MSM for another reason. I think it's for his fermenting gut. And when we did the next test, a whole load of other toxic metals came out that we hadn't seen previously, like aluminium, tungsten, tin, gallium, gadolinium, bismuth, a whole load of them, which was just fascinating because, I'd never seen these come out in a heavy metal test before. So that made me start thinking, what's going on here? Now, what I'm about to say now is hypothesis, but it kind of makes sense. We know MSM or sulfur is essential for exclusion zone water. We know that any charged metal ion, whether it's aluminium or selenium or magnesium, whatever, will have a coating of exclusion zone water over it because the charges make that happen. And my view is that having that coating of EZ water is like putting clothes on a human being. So if 6 naked men walked into my office, I don't suppose that day is having that, but I might have difficulty, working out who was who. But if one was dressed up as the Pope, and one was as a policeman, and one was in a soldier's uniform, I'd know exactly who was who. I'd recognise them from their clothes. And my guess is that is the same with minerals in the body. If they have got a good coating of exclusion zone water, as magnified by sulfur, then the body can much more readily distinguish that's a friendly zinc, we want that. That's an unfriendly mercury, we can get rid of that. And of course, that is very important. But that also explains why when I do these urine tests, if I use DMSA, yes, it pulls out the heavy metals, or some of them, but it also pulls out many of the friendlies as well. It pulls out, always get high levels of copper, often get high levels of zinc, selenium, manganese, cobalt, chromium. But when I do this test with MSM, those levels are normal. So what that tells me is that the MSM is in some way allowing the body to separate the friendlies from the unfriendlies and chuck out the unfriendlies. Now, if that is the case, and as we speak, I'm organising a citizens paper. So these are some of my patients who are self-funding, who are doing this test. The deal is they have to pay for the test, but they get my interpretation for nothing. So that's my input, and then we will publish this, the multi-authorship. So every person who takes part will become an author of this paper. So it would be Myhill et al. To confirm if that observation holds true for larger numbers of people. So would be so interesting, because if this is the case, then MSM, which is so cheap, you can buy 30 kilograms of, you can buy a kilogram of organic MSM for about 30 quid. And it's very inexpensive. So everybody can do this. And everybody should do this, because guess what? We're all poisoned by heavy metals. And you might say, well, why are we all poisoned by heavy metals? And the answer is mining. As soon as you start to mobilise oil, gas, coal from the Earth's crust, you're going to be mobilising all these heavy metals that inevitably get into farming, that inevitably get into the food chain, that inevitably contaminate our food and our water and the atmosphere. So whether we like it or not, we're all increasingly exposed. But the joy is MSM could be a brilliant way to protect us.
Okay, so MSM can pull these heavy metals out. What comes up for me as you explain that is safely getting them out of the body once they're mobilized. Does MSM do that?
Absolutely. And I know that because we're measuring it in the urine. These tests, I'm seeing great spunks of tungsten, tin, aluminium. Now, I'm so pleased about that, because aluminium is one of the most abundant metals in the Earth's crust. And we're all exposed to aluminium, whether we like it or not. Aluminium cans, aluminium foil, aluminium in vaccines, we're all exposed to aluminium. Now, the expert in this is a guy called Chris Exley. He's a professor. His nickname is Mr. Aluminium. There's nothing he doesn't know about aluminium. And he maintained that the only effective way to get aluminium out is to take silica water. Now, silica water directly displaces aluminium from its binding sites and out it comes. Yes, that's true, but silica water is very expensive. Many of my patients with fatigue syndrome, they can't work. They haven't got any money. They can't afford silica water, but they can afford MSM. That's a fraction of the price. And, I'm seeing spikes of aluminium in so many cases that, I don't know for sure that it does it, but I'm fairly confident that will be effective.
Okay, that makes sense now that you re-explain that. You're seeing it in the urine, these different heavy metals, so we know they're coming out. Just to layer on top of that, I guess my only concern still would be, are certain ones being mobilized and then redeposited in the body?
Possibly, but the fact is, if it's coming out in the urine, that's a net loss. You do raise a very interesting point there, because I had one person get in touch with me, thankfully not one of my patients, who thought, right, I can take MSM, and started herself on big doses of, and she immediately went into atrial fibrillation. Now, there may have been other reasons. I mean, she was in her 70s, but thankfully when she stopped the MSM, she jumped back into normal rhythm. So, and even when I started on MSM, and again, always start low doses and build up slowly, I got quite a marked detox reaction. I just didn't feel right I got quite a nasty headache. I didn't feel right for a couple of weeks, and then that all tailed off. So to me, getting those sort of detox reactions, and I'm not the only person that's experienced those, is a good sign. It tells me, yes, the MSM is mobilizing the stuff, but as I say, it's coming out in the urine. There is a net loss of it overall. So what that means, and this is a general rule that applies across the board, especially to people who are very sick, is whenever you put in place a healing intervention, which might be diet, it might be supplements, it might be sorting out the fermenting gut, it might be detoxing. Whenever you put in place a healing intervention, expect a healing crisis. And this is a very well recognized phenomenon in homeopathy and naturopathic medicine, for example. Either because you're detoxing, because you're mobilizing, maybe because you're getting a Herxheimer reaction because you're killing off offending microbes. So the general rule is, the sicker the person is, the lower and the slower you go. And sometimes when I see very sick patients, and as I call it, the clinical waters are muddy. They've got a shopping list of symptoms. They've been sick for decades. Nobody, they're taking all these drugs. Nobody has really been able to impact. Sometimes it's impossible to say this symptom is due to that, or this picture is due to the other. You just have to put it all in place. But you have to go slowly, and you have to start low and go slow. And getting these healing crises, these detox reactions, these diet reactions, these Herxheimer reactions, as they're called, see that as a good sign. So what this means is that the road to recovery is not going to be a smooth path. It's not going to be an easy route. It's going to be a bumpy path. And, you'll get a bit better. Oh, and then you have a problem. And then you get a bit better. And then there'll be another problem as you mobilize these chemicals and move things on. And that's, for many people, that's very difficult. It's very discouraging. And this is why people have to really understand, or have a good idea or clear idea in their own mind's eye of the path that they're having to tread, and the route they're having to follow, so that when things do go wrong, they know, I know I'm doing the right thing. Intellectually, this is correct. I have to take a leap of faith and just stick with it, and then it comes right again. So as I say, it's always a bumpy ride.
All right, to recap on upper fermenting gut, we go on the PK diet, we starve these microbes. We've talked about MSM, iodine, vitamin C. Let's go over what dosages and specifics about taking those supplements.
Okay.
And then let's end that piece. How long does all this take?
Okay. With dosages, I usually aim for vitamin C 5 grams a day. Iodine, Lugol's iodine, 15%, 3 drops last thing at night. Now, the thing is to separate vitamin C and iodine. One is a reducing agent, the other is an oxidizing agent. One's an electron donor, the other's an electron receiver. I can never remember which way around it is, but it doesn't matter. The thing to remember is, don't take them at the same time. And then MSM, build up to 3 teaspoons a day for a window of time of maybe 3 months, and then down to a maintenance dose of half a teaspoon a day. What we haven't talked about, of course, which is another fantastic way to clean up the upper fermenting gut, is intermittent fasting, time-restricted eating. And, of course, if you feed the stomach nothing at all, then the microbes have got nothing to ferment. And for many people, they have to kickstart the whole thing with maybe, a fast. Sometimes up to a 3-day fast is very doable. So I do a 3-day fast every spring, summer, autumn, winter. And then in the day, I time restrict eating and maybe have 1 meal a week. So time-restricted eating is also additionally helpful. But again, the rules are, the sicker you are, the slower you go. So how long do you have to do this? And the answer is you do it for life. Because as soon as you go back to your wicked ways of ultra-processed foods and white bread and stuff, you will start fermenting all over again. So, and guess what? If greedy me settled down and ate, a pound of grapes, I would probably have a fermenting gut, because that volume of food, all that sugar and yeast, and I would burp. That's often a sign that, I've got an upper fermenting gut. So it's a very dynamic thing. And guess what? Primitive man, he would have had an upper fermenting gut for a brief window of time in the autumn. But of course, you can deal with it for a short window of time. And if that's the price of getting fat for survival for the winter, then it's a good payoff, isn't it? So the PK diet is the evolutionary correct diet that we should all be doing for life in order to live life to our full potential. And I'll give you an example there. Shut me up if you told this story. But I used to look after an old boy. He's a friend of mine, Tony. He wrote a fantastic book about his exploits in the Navy during the Second World War. And he used to run the odd dinner party. And when he was aged 95, I could see he was struggling a little bit. So I said, why don't you come and live in my granny flat? So yes, he said he'd like to do that very much. So of course, I fed him a PK diet and jabbed up with B12 and gave him vitamins, minerals and all that stuff. And he died last October, aged 102. And when he died, he had all his faculties about him. He's a great raconteur. He remembered every detail of what had gone on in the war. His brain was as sharp as a tack. No cancer, no heart disease. He just ran out of energy, I think. But he just died in his sleep. But the point is that's how I want to live my life. I want to live it to its full potential, with my brain functioning well, with my body working well, because I like doing things. And then, one day I'll just drop off my perch like that. That's how we should all die. A good life, and then drop it. And what's happening at the moment? People are getting symptoms, getting pathology mainly because of poor quality diet, and then they get given a drug which suppresses their symptoms. And suppressing symptoms is a bad thing to do, because we have symptoms for very good reason. It tells us there's something wrong, and they just go downhill, 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 and they end up in a wheelchair and a stick in a home and go demented. It's a miserable existence. That is not for you, and it's not for me.
I agree. For somebody who is going to periodically have carbs or sugar, the upper fermenting gut can come back. You just talked about that. But once somebody decides to attack it with this protocol, how quickly does it reverse? Is it days? Is it weeks?
No, a few days. You can get rid of it. I mean, one of the upper fermenting guts is Helicobacter microbes is Helicobacter pylori. Most people know of H. pylori. We know it's the driver of stomach ulcers and duodenal ulcers and the like. And when I was writing my book, The Infection Game, I thought, I wonder if anybody's treated Helicobacter pylori with vitamin C or iodine. And I found a Polish study of, I think it was about 35, 36 people, all being diagnosed with Helicobacter pylori. And all they did was give them 5 grams of vitamin C. Now, if you'd said to me, any chance that getting rid of H. pylori, I'd say, no, it's a really tough microbe, no chance. No special diets, no iodine, no intermittent fasting, just 5 grams of vitamin C a day. And I was amazed to read that a third of them got rid of Helicobacter pylori just with 5 grams of vitamin C a day. I have to say, I was blown away with that result, because normally the treatment is at least 2, maybe 3 antibiotics and a proton pump inhibitor, and that does about 90%. But as I say, these simple interventions will get rid of some quite really nasty, aggressive little microbes in the upper gut.
I know you're not a fan of dairy, but are you familiar with Dr. William Davis and his L-Reuteri yogurt? He uses a half and half to make this yogurt that fights SIBO.
Okay, well, I'm ashamed to say I'm not familiar with that work, but the point is, yogurt. The problem with dairy products is, well, first of all, the fat is fine. The safest dairy product is butter. I'm very happy for people to have as much butter as they like. But again, we look for an evolutionary explanation. And dairy products evolved for young mammals. If young mammals don't grow very quickly, they get eaten by saber-toothed tigers. So all dairy products contain growth promoters, and that's the milk protein. The milk protein is growth promoting, which is great if you're a young mammal wanting to grow, but not great if you're a mature adult not wanting to get cancer. And we know dairy products are a risk factor for breast cancer and probably prostate cancer as well. So that's the problem with milk protein. And the other problem with milk is the sugar. Now, of course, yogurt has had that sugar fermented out, so that will be a safer version of. But I'm always a bit nervous about dairy products because dairy allergy is very common. And of course, I'm dairy allergic myself, which is why I'm particularly, sensitized to that issue, perhaps. But I can get away with butter. Which of course is almost pure fat. And again, studies have been done. There's a lovely paper by David Fried and Margaret Moss called The Cow and the Coronary, where they looked at incidence of heart disease throughout Europe, country by country. And essentially, the more dairy products consumed, the greater the risk of heart disease. And there are two reasons for that. The first is that the proportion of calcium and magnesium in dairy products. Now, our physiological requirements of a calcium magnesium 1:1. Dairy products, it's 10 parts calcium to 1 part magnesium. Now, those two minerals are absorbed by the same mechanism. So if you've got a lot of calcium there, you're going to malabsorb magnesium. And magnesium deficiency is pretty much pandemic. We're all magnesium deficient, almost without exception. And that, is a risk factor for hearts because you need calcium for activation. You need calcium for muscles to contract and for nerves to fire, but you need magnesium for them to relax. So magnesium is a really important part of what's called diastolic dysfunction. When the heart contracts, if it doesn't relax properly, if it's stiff, then it can't fill efficiently, and if it can't fill efficiently, then cardiac output will fall. So that stiffness, that diastolic dysfunction, is a magnesium deficiency symptom. So that's one reason. Also for dysrhythmias, if the commonest cardiac dysrhythmias are ectopic beats, when the heart throws in an extra beat, and you will be told by your cardiologist, "Oh, don't worry about that. That's common. Everybody gets those." No, it's not normal. And the commonest cause of ectopic beats would be magnesium deficiency. After that's probably caffeine, stress, food allergy, iodine deficiency, toxic stress as well. But the point is, they are not normal, and magnesium deficiency is a common cause. That I'll tell you another story.
Please.
This pertains to, I think it's 2006. It was the Great Northern Run. Now, that's a half marathon that's held annually up in the Northeast. And it's held in the spring. And on this particular day, it was incredibly hot. It was a very hot day. They had 13,000 runners turn up for this half marathon, and off they set. 4 blokes dropped dead. And when they came to post-mortem, the post-mortem was normal. And they were diagnosed with, don't laugh now, sudden adult death syndrome. I mean, it's laughable, isn't it? That could be used as a diagnosis, Anyway, but the question is, why did they die? Now, as I said, we're all magnesium deficient. But when you run, you sweat a lot and you pee out a lot of magnesium. And my guess is those 4 guys were borderline magnesium deficient. And when they're running, it was a very hot day. It's towards the end of the run. They're sweating. They suddenly developed acute magnesium deficiency. So the heart contracted with calcium, but couldn't relax. There wasn't enough magnesium for it to relax. And the heart just stopped in systole. And the observation, they all just went down like that. And of course, by the time you come to post-mortem, you won't see that, will you? Because, it's days later and the heart has had a chance to go floppy again. So my guess, and it is only a guess, is they died from magnesium deficiency.
All right, Sarah, I know we're coming up on time, but a few loose ends I want to make sure we tie up.
Okay.
We've talked about upper fermenting gut, the 3 supplements that help there. You gave dosages. But I believe from our first chat, MSM is something we take periodically. Can you explain that?
Well, you can take it any way you like. So if you've got a problem, then what I would do is I'd say load up with it until you've got ahead of that game and then reduce to a maintenance state. Now, if you're carnivore, you probably don't need it because there's lots of sulfur in meat. But if you're anything less than carnivore, or if you're poisoned, and guess what? We are all poisoned. It would be a good idea to have it half a teaspoon a day, or, I don't remember to take half a teaspoon a day, but I do have bone broth. And when I have my cup of bone broth, I put MSM in that. So that So it becomes part of your normal life. And I think MSM, because we're all sulfur deficient, it is organic. It's the body's natural source, or rather life's natural source of sulfur. Then I think it's a very good thing to take.
Got it. So we can take it daily.
Of course.
And it helps with easy water. You explained that and got into what easy water is. I'll add a couple other modalities that can help structure water in the body. One being grounding and getting sunshine.
Correct. Heat.
How do you feel about, and heat? Talk about that.
Well, for good quality exclusion zone water, in fact, this is a real mystery to Gerald Pollack, because he could see in his experiments that this exclusion zone water was being formed, that membranes were becoming charged, so much so that he could put an electrode in the membrane, an electrode in the water, and light a light up. Now, as we know, as we say in this country in Yorkshire, you don't get out for nout, you don't get something for nothing. And he was saying, where is this energy coming from that allows this EZ water to form? And through just a bit of luck, he realised it was the background temperature that was critical. So for EZ water to form, we've got to have external radiation. And any radiation will do. Even electromagnetic radiation from the stars does something. So you can put exclusion zone water in a very cold environment, sealed up, and you will still get some EZ water forming. And that's probably safe from the stars. But we know that the most efficient is far infrared heat. And far infrared heat at, guess what? Body temperature of 37 degrees gives us the best quality EZ water. Now, obviously, if we're running nice and warm because we're healthy, we make it from our muscles, just the business of living. No engine is 100% efficient, and mitochondria are not 100% efficient, and some energy will be lost as heat. But of course, sunshine is free heat, isn't it? It's free far infrared. And that's why we all feel so good in sunshine, because the far infrared light penetrates our skin by some centimeters and massively improves EZ water in our bloodstream. So it improves the circulation of the blood. It warms up our muscles, so our muscles work better. It reduces friction in the tissues, so it gets rid of our aches and pains. It's helpful in a multiplicity of ways through its action on EZ water. So heat, far infrared, is incredibly helpful.
Okay, we're going to end on this. You've made it clear we're all poisoned in the modern world. MSM helps with heavy metals, but let's get into other detox protocols, modalities that can go along with the MSM to help keep the body as toxin-free as possible.
Well, the one we haven't talked about at length is the heating regimes. So we have a lot of toxins that dump in our fat. And I know that because I've done fat biopsies and we can see them there. As I say, I've never seen a normal result. And we can get rid of those through heating regimes, because when you warm up the fat, then you literally boil off these molecules onto the lipid layer on the surface of the skin, and from whence they can be washed off. Now, we know this from a study done by Bill Ray. Now, Bill Ray was a cardiothoracic surgeon working in the 1970s, and in those days, the anaesthetic gases weren't scavenged. And he got poisoned by anaesthetic gases, and that switched on a multiple chemical sensitivity. So sensitivity to chemicals often follows a poisoning. And he set up in Dallas, in Texas, the environmental center there for people with multiple chemical sensitivity. And he realized that he had to reduce their toxic load. So he did blood tests of toxicity on 210 patients. And then he put them through this detox regime that involved heating regimes, massage, physical massage to mobilize the toxins in the fat, and then it's washing off. And then again, heating regimes, massage, and washing off. And what was so interesting after 210 patients is 200 initially got a healing crisis. Initially, 200 of those patients got worse. But then as the regimes continued, the majority of patients got better, the levels in the blood came down, and they were detoxing effectively. I've repeated those tests by doing fat biopsies before and after and confirm those results. But I think you can enhance those results by putting clean oils onto your skin. So I've got a detox cream I use, which anybody can make up. There's no secret recipes, just organic coconut oil, which I blend with organic shea butter. Now I put in a bit of extra vitamin C and a vitamin D, but that's not essential. Cover your skin with that. It's a little bit like oil pulling in the mouth. Cover your skin with that. And the dead cells on the surface of the skin will soak up that clean organic oil. The toxins in your own dirty subcutaneous fat will diffuse into those clean oils, which will then be shed with skin cells, because we shed about 3.5 kilograms of skin cells a year. So the skin itself will shed it. Or next time you have a shower or bath, then you will just wash it off. And again, I think we should all be doing that, because I know we're all poisoned. And everybody can do this. If you just put coconut oil on your skin, shea butter, it's got to be organic, nice clean oil. Remember, you shouldn't put nothing on your skin that you're not prepared to eat, because it gets absorbed. And you look at some of the skin creams, they've got horrible, ingredients in them. Stuff I certainly wouldn't eat, but people put it on their skin because it kind of smells nice and feels nice. But they're probably poisoning themselves in the process. So it's got to be organic, clean oils, and that will help the process even further.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
I don't think that many doctors get this, is that energy delivery mechanisms are at the root of all pathological conditions, almost without exception. They are vital in preventing and reversing dementia, preventing and